The Coalition for Reproductive Freedom is pleased that in Rhode Island we do have protections in some very specific and very concrete ways that reproductive freedom is protected. However, legislation is sometimes cumbersome, even when it works well. And so there is some more work that has to be done. There is this, it is unfortunate that there's a group of people who are not included for insurance coverage, and that is state employees and people who are on Medicaid. The right to abortion care is only theoretical if it's not affordable. And so the Equality in Abortion Coverage Act will remedy this problem. For Medicaid recipients, the affordability burden is even more ponderous. Freedom of any kind that extends only as far as your wealth and income is not really a right. It's a privilege, and maybe a privilege that other people have. So the biased policy must end, and it can end. Clearly, wealth and income provide a myriad of opportunities for families and individuals. And unfortunately, in America today, wealth and income is unequally distributed. So that the top 20% earners are coming home with 50% of the wealth and income, whereas the lowest 20% earners are coming home with 3.5%. Restricting access to health care for people who rely on Medicaid only adds to their socioeconomic vulnerability. Restricting access while ignoring privilege that others have is cruel, if not oppressive. Health insurance determines access, not need. To place coverage restrictions on abortion is an additional burden those individuals and families could least afford. We see it as a moral obligation to correct this systemic inequity, to replace this frayed thread in the social fabric would actually benefit everyone. So, the right to have children, to not have children, the right to parent in a safe and healthy environment is rooted in our basic ability, our basic right to make decisions about our own lives. People should have the social, the spiritual, the economic, and the political means to parent responsibly and to experience the sacred gift of sexuality with health and with wholeness. Amen. Amen.